Welcome back. We are having our first conversation for the morning, and as we mentioned, it's all about critical care training in Belize with the World Health Organization. We are joined by 4 representatives to talk to us about that this morning. Starting things off, we have here with us Dr. Karen Lewis-Bell, and she is a representative of PAHO and, of course, the WHO. And to her left is Dr. Jorge Polanco, and he is the Director of Health Services with the Ministry of Health. And over to my right, we have with us Dr. Jorge as well, but we know him as Dr. Hidalgo, and he is an intensive care medical doctor. And to his right is also Dr. Jean Young Sung, and he is a professor of neurocritical care in LA, USA. Thank you guys so much for joining us, and good morning again. So critical care in Belize. Before we even jump into the activities that are set to take place, let's talk about what critical care is and how is that different from regular care that you get or intensive care
and so forth. Yeah.
Well, first of all, thanks for having us, and it's a real pleasure. And critical care means that we need to treat the critical ill patients, those that have a condition that it will essentially are in the side of just a lot of risk of dying.
Mm-hmm.
I mean that, of course, to provide critical care, we need to have certain resources, also medical facilities to provide with that. But not only that, the most important thing, we need to have the personnel, the skilled personnel to start and treat those type of patients.
That's what I was going to ask, because I would imagine you are all, experts of doctors in your own right and so on. But I've always wondered, what do you do when your patient goes into a particular state that is now critical and you have to act quick? All of your training that comes into effect, how do you stabilize your brain and create yourself in a space that, all right, I have to be calm, I have to be able to act now and follow through to be able to help my patient. How do you even do that? Dr. Bell? Dr. Polanco?
Well, those who are practicing clinical medicine now are best able to respond. But for us, we have the training in medical school and in our specialties.
Yeah.
We are actually trained. And the important thing is to first and foremost stay calm.
Mm-hmm.
And remember the fundamentals. There are certain critical areas of the body that you have to focus on.
Yeah.
The airway to make sure they're breathing and the circulatory system.
Yeah. Okay.
But I think
let's
our
get
clinicians.
Dr. Jean Young Sung, you're a professor. Let's talk about how you would train your students when it comes to critical care.
Well, so critical care is for the care of those people who are at most risk, high risk of dying.
Mm-hmm.
So the sickest people who are in the hospital. And so the training can be very long, which it should be. So because it's the sickest patients we have, it'll be the basic medical training that everybody gets, and then usually 2 to 3 years more of the intensive care training to take care of these people for all the different advanced medical therapies that are needed and devices that are needed in the intensive care unit.
Mm-hmm. Wow. As we develop our medical services here in Belize, I'd like to ask Dr. Polanco, what is the state of our critical care services from our health facilities in Belize?
Yeah, very, very, very extremely important question, and it fits with what's happening this week. Mm-hmm. The context, to put this training in context, you are all aware of the significant prevalence of external injuries that people suffer, road traffic accidents, gunshots, etc. It's known. So this is a reality, and therefore we said it is crucial for our medical officers on the front line to really be familiarized. For some it would be a refresher course, for some it would be new topics, to be familiar with those skills, that information that is needed for them to be able to respond appropriately. It is an issue, it is a challenge, because we have medical officers trained in different schools, different programs, different settings. So one of the objectives of this training is we have brought a group of professionals, about 25, this week, and Dr. Hidalgo has coordinated along with Dr. Bell through PAHO and the colleagues who are visiting us to provide this 5-day training on what we call basic critical care. As it was mentioned, what critical care is. So it is of much relevance. There are limitations within the health system in regards to equipment, in regards to skills, but it's something that we as a ministry have been working on for the recent years. So this opportunity, I see it as extremely of much benefit, of much importance. Dr. Hidalgo mentioned it's the first time, but we hope it will not be the first and the last. It fits within a program that we have had over the last 2 to 3 years within the Ministry of Health of providing training to all our medical officers on the front line, including nurses, on basic emergency care. This is just one topic within that setting or within that topic.
So let's
If I
talk
may
about
add,
please.
Just to say that PAHO has been working with the Ministry of Health on the second United Nations Road Safety Project. And out of that project, we did a number of things, and one of the things was to have the WHO assist us in a capacity assessment of the emergency and critical care services in the country to see, and even though we focused on road traffic incidents, we had this assessment to see what was the capacity to respond, and especially the first responders. And out of that assessment came the recommendation to conduct this basic critical care. So even though the primary focus initially was on road traffic incidents, as Dr. Hidalgo has said and Dr. Polanco, it's not just for road traffic incidents or other external injuries, but for persons who may have other life-threatening conditions and illnesses.
Right.
And so it's very important that the doctors and the nurses in our primary care facilities, in our community and regional hospitals, that they have access to this training to be able to respond in a timely manner and to be able to even stabilize patients until they can be moved to the tertiary care facility in Belize.
You know what, I'm really glad that you opened with that, because that was going to be my question, how this partnership started. But there was an incident, I think last week or so, where it was rush hour, right? And there was an ambulance that had the lights on, had the sound on, had everything on, and nobody was moving. And I pulled to the side because that's what I know we're supposed to do, and it did nothing because he came right in front of me and it had to just go on with the traffic. So this particular training is that something that us as the public would be able to get information on as well. And I ask this because something as simple as that could save somebody's life. Right, being able to move yourself away from the traffic so that the ambulance can pass.
Right.
Well, this is just the start of many things and many projects and collaborations that we will have. No? Of course, as Dr. Polanco and Dr. Luis say, this is a background. I mean, just this is a small part of a big picture. No?
Okay.
I mean that, of course, one of the important things is public awareness. No? I mean that one thing goes hand to hand, and public awareness is critical.
So as Dr. Polanco mentioned, this training may come as a refresher for some of the medical practitioners, but it might also be some new information. Could you touch really briefly on some of the areas of focus that the medical practitioners will be learning about?
Yeah, I will ask Dr. Jean to do this.
So again, as I mentioned, real formal critical care training is several years after the medical school, after basic medical training. And so this training is really for those people who are not doing full-time intensive care. And so these are people who are, as Dr. Lewis said, they're out in the field, out in clinics, out in the more primary hospitals, and so that they're learning things that they've never learned, the basic critical care.
So how essentially will these medical facilities be involved in the activities? Will this be something that will take place across the country, or is it centralized to the Carl Kushner Memorial Hospital?
No, we have participants from all 6 districts.
Okay.
All 4 regional hospitals, including Carl Kushner. Apart from the treatment that should be provided at local level, a significant function of this training is that they will be able to stabilize the patients in order for them to be safely transferred, either transferred to a regional hospital or to Carl Kushner, which that process of stabilization is also critical.
Yeah. We're talking about training medics in Belize and nurses. That's a lot of people. That's a huge population in our country. Can you talk about the breakdown of how this training will take place?
Yes, well, I want to straight one thing, and it's the collaboration. Dr. Jean and myself, we represent the World Federation of Intensive and Critical Care.
Okay.
And to reach to the stage we are today is those work start several months ago on preparation and talking with the players that are needed. And I want to essentially say and give a big thanks to Ministry of Health, to Dr. Polanco, Dr. Mori, and of course PAHO, because they have been really instrumental of this training to happen, and of course the future ahead. No? I mean that we are really glad to have people that have the willingness to and open to this type of collaboration. I mean that the idea today is we have this 5 days training course that involves the physicians and nurses. I mean that because to provide ICU is a team effort. And we are really happy. We are starting from the very basic to recognize that someone is critically ill, what to do, and as already mentioned, is we have the resources to treat this patient in this facility, or we don't have, then we need to prepare this patient for taking to a more resource facility. You know.
And you know, that's a really interesting point, Dr. Hidalgo, because for me, I thought essentially that intensive care begins immediately when there's contact with an individual that needs that care. So for me, I thought that it began from the medic, as April mentioned, where you call an ambulance, there's someone with a gunshot injury. You know, does that person need to be equipped with intensive care knowledge, or does it begin when that individual reaches a hospital?
Yeah. It begins at the moment of that first contact, and that is the reason why the EMTs, the emergency medical technicians, they have a training. There is a formal training.
Okay.
There are 3 different levels of training for that type of care.
Okay.
And BERT
Yes.
is one of the organizations that trains them formally, and they are certified every 2 years. So they have a very important role to play, very specific training to be able to attend, let us say it's a road traffic accident, what to do, how to do it, when to do it,
Right.
what to intervene,
Yeah.
what action to take. At that moment, the care begins
Yeah.
at that level, and then it just increases in complexity until it reaches to the specialist,
Yeah.
either at the intensive care unit or a regional hospital.
I mean, there's only so much that they can do during the transit to the medical facility. I think this is such an important conversation for us to have, because a lot of times we talk about the resources that we need to improve our medical services, but I personally believe that the biggest is human resources, the information that our medical practitioners are equipped with to be able to serve their population, which is the persons that are in need of these services. So I imagine that that's one of the driving forces between this collaboration as well. Would that be fair to say, Dr. Bell?
Yes. One of our roles as PAHO, being a technical cooperation agency, is really to support the government of Belize, specifically the Ministry of Health and Wellness, to implement their own strategic plan. And one of them is really capacity building,
Right.
strengthen their human resources. And so we work very closely with Dr. Polanco and the rest of the team in the Ministry of Health to provide that technical cooperation. Sometimes we will bring expertise. We are supporting now with this capacity building bringing experts from the WHO from within the region to provide this training. And throughout the years, this is something that we have done over the past 8 years that PAHO has been in Belize, whether it's capacity building in managing malaria cases, in identifying certain diseases. So this is one of our primary roles and responsibilities in supporting the Ministry of Health.
I was wondering, as you were talking about the need for this particular training, and even though it's the first of its kind, for our practicing medics and our nurses and so forth, is this voluntary training, or is this something that we hope that they can get certification with? How are we going to involve our personnel in the medical field?
Yes, this is the first step. I believe that it's going to be more and more. This just open the doors to more education and training courses. This particular course, of course, they're going to have a certificate at the end of the training course that it will allow them to gain some CME hours as well. But most important thing is the knowledge that they are going to get, because it's a 5 days of a very, very extensive hours of training.
Does this collaboration come from the rise in cases that require critical care? For instance, we've been seeing a lot of cases of accidents on the road traffic accidents, as well as, of course, gun violence taking place in many parts of the country. But did this come from the need in providing a quicker and a better response when it comes to critical care due to the rise in cases?
Yeah, there are two situations that gave rise to this. One is the assessment that was done late last year, Dr. Bell made reference to, and the other is that the prevalence of external injuries, of situations where there is a need for critical care to be started at the local level. The road traffic accidents and all those external violences, complications in pregnant women, complications of persons who had some cardiovascular event. That happens at every district, every village. So then we know then that the need has been there.
Right.
And the other aspect is that we recognize that there has been a need, that there is a need to improve the skills of all the physicians. I want to make reference to what Dr. Hidalgo said. It's a team response. So we have been having different medical officers over the last years being trained in other areas of emergency care and nurses. And a very important aspect of this training is that this group is a core group that has been trained already. And so now, right now they are getting more information on critical care. And one of the objectives is that this group will also be able to be like trainers for the rest of this of the staff
so
at
it's a training
district level.
of trainers. Yes.
Yes, please.
Could I also say, I'm sorry, is to interrupt, but so obviously Dr. Hidalgo and I are intensive care doctors, so we firmly believe in intensive care, the importance of intensive care, but obviously, especially after COVID, where it became a very big worldwide acknowledgement that there just isn't enough critical care education throughout the world. And that probably sooner or later there will be another pandemic, and we want to be more prepared. And WHO recognized that, and so the first time ever they've actually had a focus on intensive care, because they've always had a focus on injuries, trauma, and infectious diseases, which made sense. But they now also realize, oh, actually intensive care will be needed throughout the world. Even in the U.S., the richest country in the world, during the height of the pandemic, we didn't have enough intensive care facilities. In my hospital, one of the busiest hospitals in the U.S., we had people in our lobbies. We're treating people in tents in the parking lot because we didn't have enough intensive care.
Wow.
Can I also add that the fact that the WHO has developed this course, it's new, but it's very critical and it's very important. And I think Belize should be very proud that they're the second country to actually be implementing this course.
It's the first.
Let's not focus on what's the first, but I think it's important because it speaks volumes
Yes.
in terms of the importance that, you know, the role that we are playing here, and also the importance of Dr. Polanco, Dr. Hidalgo and the team.
Yeah.
You know, and I think it's very important for Belize.
I think that, I mean, I absolutely agree with you. So as we are coming down to the wire, let's talk about when, where, and, well, you said 5 days, right? So let's talk about when the training is, when where is it taking place, and how can our other medics find out more information about it?
Well, the course already started
Okay.
Last Monday.
Okay.
It's right now ongoing, and then this is Thursday already.
Okay.
Of
So tomorrow
a
is the
very,
last day.
very busy week,
Yes.
and then tomorrow is going to be the last day.
How many medics and persons have signed up for this training?
This is because it's a core course for basically trained trainers. We have, as Dr. Polanco said, identified 25 physicians and nurses that they are taking part of this training, and we believe and we are sure we are going to have more courses in the future. This is just the very beginning. The doctors are very excited. The group that is conducting the training are very much excited as well. I mean that I think so that is going to be very critical.
Something of importance also is that this event will not just be a one event and we forget it. Part of this project, because it's part of a project, is that after the training there will be a follow-up, there will be a structure to assess the impact of this training on the physicians for a period of time. That information will be assessed, and that will guide us as to what else
That
needs
was
to
going
be
to be
done.
my next question.
And
yes.
it's not just a didactic session where people sit in a classroom and
Take
watch
notes.
presentations and take notes. It's hands-on.
Okay.
And it's very focused. So it's one facilitator to only 5 participants.
That's
So
really
that
good.
they get
Yeah.
detailed information, training, you know, on a one-on-one basis. So we didn't want to make the class too big to ensure that, you know, they are able to get the individual attention that they need and to make sure that the skills are acquired.
Wonderful. I think that this is a very critical training, much needed in Belize, and I think we're very proud to be the second country to implement it. But thank you all so much for joining us this morning, and we hope to see more of the results from this assessment as well. But thank you guys so much.
Thanks for having us.
All right.
right.
Well, we got to take another quick break, and when we come back, the conversation switches into World Down Syndrome Day. Stay with us. We'll be right back.